In today's episode, we're going over should you use isometrics to treat tendinopathy? And I'm also going to go over how I use them as a physical therapist in clinical practice. Let's do it. So, what's kind of the problem here? Well, I feel like every few years a new research study comes out talking about the next treatment for tendinopathy. Okay. So heavy slow loads are pretty popular right now. Isometrics, popular. I see surgeons all the time recommend eccentrics for tendinopathy, right? So I think what happens is that one study comes out and everyone is like, let's use this treatment, right? But there becomes a lot of confusion because there's a lot of research about a lot of different types of treatments, right? So, what is effective and what is most effective? And where do isometrics fit in? I think isometrics is actually pretty interesting because they have more of a short term effect. And I feel like most physical therapists I talk to don't know about this. They're using isometrics more for longer term effect, which I think you can use them for. But I think the research that made them popular, we're looking at this short term effect. So, in today's episode, we're going to talk a little bit about this. So, in today's episode, we're going to go over the history of isometrics. Why did they become so popular in the first place, right? Who are the researchers that originally put out this research that got the whole world kind of hot on the topic? Next, we're going to go over what are isometrics effective for? What does the evidence say about tendon problems? Next, we're going to go over where do they fit into a plan of care as a physical therapist? Where do you put them into it? Your training program, right? Next, we'll decide whether or not you even want to use them. And lastly, we'll just talk a bit about how I implement them into my own clinical practice. So before we really get going, I want to let you know about a free cheat sheet I have for you. I'll leave a link in the show notes. I definitely think you should check it out. It is an evidence-based cheat sheet to patellar tendinopathy. So I know that this talk today is about isometrics, but the large majority of research in isometrics is going to be on the patellar tendon, right? So in this cheat sheet, we're going to go over what is patellar tendinopathy, what's the prevalence of patellar tendinopathy, the clinical presentation, diagnosis, and treatment options. I definitely recommend you check it out. Like I said, isometrics are studied mainly in the patellar tendon. So I think this is going to help you out a ton. It's a free resource, and I'll leave a link in the show notes for you to check it out. Welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like yourself get your patients out of pain and back in the gym where they belong. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I have my dream job as a physical therapist, coach, and business owner and educator. I've been doing this for several decades now. I want to help you reach your goals as a coach and clinician. Let's get moving. So first and foremost, I want to start off with a little bit of history about isometrics and why they're so popular, right? Now, isometrics have been studied for a long period of time, but I feel like they got super popular around 2015. And most of this research is performed by Ebony Rio. Now, when I talk to PT students, I work at Champion Physical Therapy and Performance, and we actually work with a ton of students. And I ask them if they've ever heard of Ebony Rio before. Usually they have no idea who she is, but they're also pretty hot on isometrics, right? So Ebony Rio, in my mind, is a person who really popularized isometrics in patellar tendon pain, right? So I highly recommend you check her out if you haven't already. She's all over YouTube, right? And then I would definitely recommend reading some of these articles. I have a lot of citations from her throughout this presentation. You can check out all the references in the show notes, right? But the first study that I feel made isometrics really hot was a study in the British Journal of Sports Medicine. This is 2015. And the lead author was Ebony Rio. It's called Isometric Exercise Induces Analgesia and Reduces Inhibition in Patellar Tendinopathy, right? Very good study. They used 6 male volleyball players with patellar tendinopathy, symptomatic, all right? Keep in mind, 6 is not a very big study size, okay? We'll talk about why this is important a little bit later. So these folks, on average, had about a 7 out of 10 pain-wise on a step-down task, right? So these subjects were asked to perform a step-down task and then rate their pain during the task, around a 7 out of 10 on average, right? And what they did is they gave them 5 sets of 45-second isometric at 70% of the MVIC, right? So this is something that's actually kind of challenging to try to reproduce within a clinic, but that's what they did in the study, okay? And they checked their pain immediately after the intervention and again at 45 minutes, right? And their pain actually went down to less than a 1 out of 10. Okay. And that's crazy because they go from a 7 out of 10 to less of 1 out of 10. And that is a dramatic, dramatic change in pain. In this same study, they did the same thing with isotonics. So they just did a knee extension for sets of, I believe, of 10 for the other group. And what they found is that isotonics also reduce pain, right? However, the isometrics were actually better than isotonics. The other thing that was pretty interesting is that the isometrics reduced cortical inhibition in the brain, whereas isotonics did not, right? So if you have a painful knee, and this is going to happen with patellar tendinopathy, but really most knee problems, you're probably going to have some inhibition of the quad. So the quad doesn't want to fire well because the knee hurts. Okay. So when you do isometrics, it is going to reduce cortical inhibition in the brain, right? And isotonics did not do this. The other thing that was great about the isometrics over isotonics is that the isometrics had a change that lasted 45 minutes, right? The isotonics did not. So you can kind of see in this graph here. I apologize to the listeners of the podcast. Definitely hop on YouTube at some point to check this out. But I put a table here from one of the studies. And basically, you could see a dramatic change in pain right after the isometric intervention. And that was maintained at 45 minutes. For the isotonic group, they had a reduction in pain, not as substantial, and the pain kind of went back up again at 45 minutes. All right. Now, I think the thing that's very important to understand here is that these changes were acute. They were immediately following and up to 45 minutes after the intervention. It's not like they did isometrics and then they did it repeatedly for 4 weeks and tested their pain in this study. In this study, isometrics were shown to be very powerful for a short-term change, all right, but not necessarily a long-term change. And I think this is important because the students I work with would typically utilize isometrics because they think they're super hot. They don't realize that isometrics have been shown, at least in this study, to be very effective in the short term and not in the long term. All right. Keep that in mind as we move forward. Next, very important thing to ask is that can we reproduce these findings in other studies? So in this original study by Ebony Rio, there were 6 volleyball players, right? A, it's not that many. B, it's in male volleyball players. The population is not always going to be reproducible to every single patient that you see within the clinic, right? So in future research, do we have the same result? So here's a study in 2020 in the journal of SciMed and Sport from Holden et al. And they were looking at isotonics versus isometrics, kind of same setup as the prior study. And they were seeing if there's any pain relief during the step-down task. So same as the last study with Ebony Rio. And here's the thing. Both had an immediate reduction in pain, right? Just like in the other study. However, there's no difference between groups. So the isotonics perform the same as the isometrics. And lastly, the results did not last for 45 minutes. So they noticed an immediate change in pain right after the intervention, but that didn't stick around for 45 minutes like the study with Ebony Rio, okay? And I think studies like this, follow-up studies, are incredibly important because you can never hang your hat on one study with a really small sample size. I think this is a mistake that happens quite frequently in physical therapy because we don't have these huge sample sizes. We'll have these sample sizes of like 6 to 20, right? And then when we retest the same hypothesis in another study that's very similar in nature, we'll notice that it's not quite holding up, right? Speeds test is one of those things. Thessaly's test is one of those things. When those special tests first came out, the original research showed they were phenomenal, and then follow-up research showed it wasn't, okay? So yes, isometrics in the Ebony Rio study were much better than isotonics, but not in follow-up studies like this one. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym. 4 simple steps to getting your clients out of pain. How to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay, so I'll show you how to do that. And lastly, we'll talk a little bit about the fitness pain-free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad, that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. All right, so we're looking at the short term, the prior 2 studies. What happens in the longer term when you compare isometrics with isotonics, right? So this was pretty cool because the study was in the patellar tendon. Most of the research on isometrics so far has been in the patellar tendon. So this was kind of cool to see isometrics versus isotonics in a longer term. Okay, it's 4 weeks, so it's still relatively short term, but it's not, immediately after to 45 minutes after. And in this study, they were looking at jumping athletes, and they were in season, which I think is pretty cool because it is very, very challenging to get people's tendon pain to go down while they're in season. If you've been working as a physical therapist in the sports realm for long enough, you'll know that it stinks when you have a patient that comes in with pain in season, right? It's really tough to get pain levels to go down. But in this study, the athletes were in season. It was a 4-week-long trial. They did their exercises 4 times a week. So they either, in group A, they performed isometrics 4 times a week. In group B, they performed isotonics 4 times per week. We just wanted to see if there was a difference in the outcomes, right? And here's the thing. Both groups improved with their pain, which is great. That's awesome. Because in my experience, if you have an athlete that has a pretty bad patellar tendinopathy and they keep on competing throughout the course of the season, it tends to get worse, right? So if we intervene, it actually improves this. So good stuff. However, was there a difference between the isotonics and isometrics? There was not, right? So at least in a 4-week span, right, a longer term, although not that long term, isometrics seem to perform similarly to isotonics, right? So in the end of the day, does it really matter whether or not using isometrics or isotonics for more of these longer term outcomes? At least based on this study, it seems not. So the next piece is that, does this change in other tendons in the body, right? The patellar tendon isn't the only tendon that matters, right? We gotta worry about some other tendons. And oftentimes, research in one tendon for a treatment that shows positive effect doesn't show that same positive effect in another tendon somewhere else in the body, right? So what does the research say on other tendons? Well, I have 2 studies here from the Achilles tendon. And the first study is going to be from Bradford et al. Ebony Rio was also an author on this paper in 2021 from the International Journal of Sports Physical Therapy. And they utilized the same protocol as in the patellar tendon, 5 sets, 45 seconds, 70% MVIC. And what they found is that they got a 50% reduction in pain during a functional load test. So think about something like a calf raise. Ask the patient what their pain is during the calf raise, put them through the isometrics, and immediately afterwards, have them do the calf raise. Does it make your tendon pain better, right? And it did. There was a 50% reduction in pain during the test. The issue with this study is that they didn't have a control group doing isotonics. Would have been nice to see isometrics versus isotonics. They kind of skipped that. They were looking at different degrees of knee flexion when they did this test, and they weren't looking at isotonics versus isometrics. However, they did find a positive effect for isometrics, so that's good. And this is actually a study performed previously in 2020 by Vanderlist et al., and they were looking at isometrics and seeing if there was a reduction in pain following the isometrics, similar to the patellar tendinopathy research. And they found there was no reduction in pain immediately afterwards. So this was a little bit sad, right? Follow-up studies in the Achilles, and actually this study was performed prior to the more recent study with from Bradford and Rio that I just mentioned. They actually showed that isometrics were not helpful in reducing pain immediately after performing isometrics, right? So when we look at other tendons, it seems like the research is a little bit mixed whether or not isometrics reduce pain, right? We're also not sure if isotonics perform similarly to isometrics. All right, so we covered the patellar tendon a little bit. We covered the Achilles tendon. There's still more tendons in the body, right? If we start to look broadly at the medical research on isometrics and tendon pain, what do we start finding? Now, first, I want you to take this research with a grain of salt. Anytime you start lumping in a bunch of different types of pathologies and a bunch of different populations, the results are sometimes a little misleading, right? So just keep that in mind. However, I just wanted to mention this study because I think it is a little bit illuminating. So it was in the British Medical Journal, and this was in 2020, and it was the effectiveness of isometric exercise in the management of tendinopathy, a systematic review and meta-analysis of randomized controlled trials. This is from Clifford et al. They were looking at 10 different studies, and they're looking at several different tendon pathologies. So patellar tendinopathy, rotator cuff tendinopathy, tennis elbow, Achilles tendinopathy, and gluteal tendinopathies, which is glute medius tendinopathies. 4 patellar tendon studies, 2 rotator cuff studies, 2 tennis elbow studies, 1 Achilles study, and 1 glute medius tendinopathy study. And what they found broadly was that isometric exercise was not superior to isotonic exercise for chronic tendinopathy. And this is either immediately following treatment or in the short term, which they defined as less than 12 weeks. So when they were lumping together all of these different tendon pathologies, different populations, they found that isometrics were not better for reducing pain in the immediate term. So basically, you do the isometrics or you do the isotonics, and then you check the pain immediately afterwards. And in the longer term, up to 12 weeks, did not show a difference in pain, although largely exercise is beneficial for tendinopathy, right? So it kind of gets you thinking, do I really need to include isometrics in my program with my patients if research like this is showing there's not a difference between isometrics and isotonics, right? All right, so I just want to summarize the information we just went over about isometrics. First and foremost, are isometrics effective for pain? And I think the answer is yes, right? They are definitely effective for pain, both in the short term and the longer term. There are some odd studies out there, like the Achilles tendon study I mentioned previously, where there's no reduction in pain. We'll talk a little bit more about this in the next episode. Are they better for short-term relief? Well, this is going to depend on the study. The research that's been done by Ebony Rio does show a strong effect of isometrics, which, at least in the patellar tendon article, seems to be better than isotonics. It also seems as though the specific protocol that Ebony Rio uses works pretty dang well. And some of the other protocols, maybe not quite as much. So do keep that in mind when we're trying to compare isometrics versus isotonics. It seems like the protocol that Ebony Rio uses, 5 sets of 45 seconds, 70% of MBIC, is effective, right? But maybe some of the other protocols are not. Next, can they be used as part of a rehab program? And that definitely is yes, right? In the next episode, we'll talk about how I like to do that. So if you are loving what you are learning right now, I highly recommend you check out my Fitness Pain-Free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away. So that's it for today's episode. In the next episode, we'll talk a little about how I like to use isometrics to treat my patients with tendinopathy. And lastly, thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, please hit that like button, comment, and subscribe. It helps me out tremendously. If you're watching this as a podcast, please leave me a positive rating and review. Helps a ton with the algorithm, helps me grow. If you want to see me do more of these in the future, that would help out a ton. I highly appreciate it. If you want to go that extra step in supporting me, consider subscribing to Fitness Pain Free Insiders. It's basically a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for coaches and physical therapists. It's all premium content from me, similar to the Fitness Pain Free Show, but more in depth. It's updated monthly. I've been doing this for the past 5 years or so. It's got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group to me. We have all your questions answered. You can get started. There's a trial period. It's actually prices bumped up. I apologize, it's a little bit old, to $5 a month, right? For 1 week, and you try it out. If you don't like it, you can cancel at any time. But like I said, if you want to support me a little bit further and take that next step in your learning experience, Fitness Pain Free Insiders is it. I'll leave a link in the show notes, but if you want to get started right away, head to fitnesspainfree.com, click on the programs link, and click on Fitness Pain Free Insiders online library. And I'll see you there on the inside. If you want to check out the references, I will also leave them in the show notes. You can tell me if I missed any references or maybe I misinterpreted the literature. If you feel like I did, please let me know. Leave a link in the comments, and I'll see you guys on the next one. Thank you.